Welcome to Insight, produced in partnership with Howard University's WHUT. Today we are chatting with Dr. Kurt Newman, President and CEO of the Children's National Health System. Kurt has generously agreed to share some of his experience with us. I'd like to thank you, Kurt, for joining us today.
Well, thank you, Mark.
So this organization is so important in this area. Talk about the extent of your operations and your mission.
Children's National is started as a hospital, but it started right after the Civil War. So we've been in operation almost 150 years. It started as a little hospital taking care of the needs of kids at that time. And of course, we've evolved over the decades now into a health system for children. At the heart of it is a hospital, but it's so much more. We have clinics in parts of the city here in Washington, D.C., where there are not enough doctors and nurses. We have mental health facilities around the city and in the region, specialty clinics around the region. We work with other hospitals. And when there's areas that we can't get to with a traditional clinic or doctor's offices, we have mobile health. So we have vans that go out to get to the kids. We want to be where the kids are. We also have a program now with the school system here in the district to provide the school nurses in the school. And we can provide a lot of services and contact and access for kids. So the whole goal, beyond what people think about when they think of a hospital, where we have emergency departments and intensive care units, operating rooms, and research, and we're training. But it's really a broad, integrated system to help children and families.
Talk about how the organization has evolved as the definitions of health have evolved within your leadership.
Well, even thinking about my own personal story, for most of my career, I was a pediatric surgeon. So my life was diagnosing and operating on children, surgical conditions. And one of the things that was different about children, though, that I always enjoyed and loved about the pediatric world and pediatric specialists in Children's Hospital was not only were we thinking about the solutions of today, like the problem in front of us, and in my case as a surgeon, what's right there, but also thinking about the impact long term. So what we do today, how is that going to impact that child? And maybe it's a different operation on a child than it might be in an adult. If you draw that out more widely, and as I thought about becoming a leader and then 6 years ago became the CEO of the hospital, I really had to think myself on a bigger scale and more broadly, well, what are the issues of children? What's really affecting families, and how can Children's National play a bigger role in that impact? We're the Children's Hospital here in the nation's capital, so we've got this, in a sense, responsibility to think that way.
And as CEO, you're also directing how you invest your expense capital into service. So you are making everyday decisions on where the emphasis should lie and how do you create balanced health for an entire group of children in a whole region.
Absolutely, and there's a big need, and we have some of the biggest disparities in health care for children right here in Washington, D.C., whether it's infant mortality, asthma statistics, mental health conditions. So when I was interviewing with the search committee, they knew I was a surgeon in chief of surgery. They said, well, what's the next big frontier for you? And I think it surprised them a little bit when I had been thinking about this, that our identification and our mobilization around mental and behavioral health issues just wasn't where I thought it should be for a children's hospital. And I looked around the country, and a lot of the children's hospitals weren't, I thought, paying as much attention to those issues. And even nationally, there wasn't a lot of conversation around that. It was very interesting. But the board really got excited by that, because when you look at the statistics, 20% of children will have some type of mental or behavioral health issue during their childhood. And frequently, they're not recognized. Or even when it's recognized, Mark, it can be almost 8 years from when somebody sees that there's something, an issue, before that child gets treatment. And the interesting thing is, is that if you intervene, if you make a determination around whether it's depression, eating disorder, anxiety, autism, if almost everything in pediatrics, if you can identify things early, you can have a better outcome if
Right.
you get on it. And I think the other exciting frontier is that with the research that's coming along in genetics, and if we can identify these things early, we're going to have treatments and solutions. But back to your question, it is a matter of prioritization and balance. So as CEO, we've been able, with my management team and our organization, to pivot the investments more into the community and to build more access and to have mental health providers in our primary care clinics so that they can help when we're screening the kids for mental health issues. We can have a provider right there. Or if we don't have enough, we can use something like telemedicine so we can access that. So the whole key is to try and provide more access. It's not easy because the reimbursement system, for example,
Right.
does not favor treatment of mental health conditions.
Well, you end up moving into community health and creating a healthy community. The reimbursement systems are not focused on healthy communities. The reimbursement systems are focused on, I have a broken arm, fix my arm. But what happens if you have a child who has gone through so much stress that they go into cycles of depression? You don't see that, but that child is as impacted, perhaps even more impacted, their future is more impacted by this untreated circumstance, this untreated condition. And the reimbursement system really doesn't take that into account. So how do you navigate that so that you have a financially responsible stewardship of the assets that you are managing, yet ensuring that you're doing the right thing when the reimbursement system doesn't incentivize you to do the right thing?
Well, the current business model in a lot of markets, and in Washington is one of those, is that you generally get paid in healthcare for doing things, for more procedures, more visits, more prescriptions,
More tests,
more whatever it is. I think there's an emerging consensus that as a society, we need to look differently at that and find ways of paying for prevention and avoiding healthcare costs. And we have a number of programs where the benefit and the impact is so obvious, where and one, for example, is around asthma. We have one of the highest rates of children coming to the emergency department for asthma in the country. So one of our doctors, Dr. Stephen Teach, had the idea of, well, let's look at a visit to the emergency department for a child with asthma as a failure of the system. Yeah, we get paid well for taking care, but let's look at it in a different way. And this is where, for us, philanthropy comes in. So we could take on a program like this, which was designed to decrease emergency room visits because we could support the doctors and the leaders that were doing that. So what happened was, when we identified that a child or a family had come to the emergency department because they're of asthma, that was a failure of the healthcare system. That was a failure. And then we would put more resources on that child and family so that we could prevent that from happening again. And what we've seen is that decreases the incidence of emergency department visits in those kids by 40%. I mean, it's a huge impact. Now we're tying that into with the school nurses because we have that access, so we can alert them about this child. They have a plan. They can stay on their prevention. And it really is the direction we want to go with all of the many of these chronic diseases, whether it's asthma, whether it's mental health, whether it's prenatal care for mothers with babies, so that they don't need the hospital.
So you're talking about an operating infrastructure that is so much more sophisticated than the traditional sort of hospital administrative infrastructure that you previously had.
That's right, and a key to that is going beyond the hospital and our health system itself and looking for partnerships, collaborators in the community to help build an ecosystem, because it's not a narrow set of issues that's just defined by health, but it gets into education in the schools.
You have to go out of your own comfort zone and the comfort zone of your staff.
Absolutely. So, I was getting out of my comfort zone being a surgeon, getting into the C-suite, but now it's, in the neighborhoods, and, where does nutrition come in, or where does housing is a critical issue, and then working with others and other organizations to provide the support and framework for these children and these families to succeed.
If you talk about children on a continuum of prosperity, with your services to very poor children, or children from poor families, and children from very wealthy families, how does that curve look in terms of who you serve?
One of the ways of looking at it is that over half the children we care for are on Medicaid.
Over half?
Over half, 55%.
Over half receive public assistance
for their health care.
For their health care.
And that's usually a marker of poverty. And it's such an important program because it does provide access for these children. And it's a very good program. And we work with 3 different states: Maryland, the District of Columbia, and Virginia. And what you see there, it's such an important program, yet the conversation is troubling around health policy, because a lot of people don't understand necessarily how important that program is for the health of children, whether it's prevention and providing. And it's very efficient, because if kids get the prevention, and if they get the care they need for some of these potentially chronic diseases, we can prevent a lot of the costs in the future. If you are on top of a mental health condition, or getting asthma early, or obesity, diabetes, we can prevent a lot of the adult manifestations of that and complications. So it's really a very cost-effective investment, and that's what's so frustrating sometimes.
And that's the key. There seems sometimes to be a conversation as if the choice is between spending or not spending, and that's not the conversation. It's spending a little now, or spending more later, or spending a lot more later. Right, so it goes directly with this kind of early intervention funding.
Yes, I think you articulated that beautifully, because we are going to spend on these issues. It's just a matter of when and how much. And my view is, if we do it early. I want to come back to something, though. These issues are not just the issues of children, without resources or on Medicaid. And so the mental health issues and behavioral health issues are just as prevalent in families with lots of resources. It's just that they tend to have, those families and tend to have more access to getting treatment. So there is that disparity.
So you wrote the book Healing Children, and the proceeds are going to
research. I'm so passionate about doing more research for children and their issues. So that was where I wanted the resources to go. But the real drive behind writing a book was to empower parents and society on a larger scale about the special value of pediatric medicine, specialist hospitals, this world that I've lived in, that I know, and I know that feel that if people knew more about it, they would come to some of the same conclusions I've come to over the years. But it's told through stories from my career as a surgeon and now CEO.
Well, it's a great service that you provide to the children of this area. and a great perspective. And thank you so much for sharing your stories as a surgeon and as a hospital administrator. Dr. Kurt Newman of the Children's National Health System, thank you so much for sharing your wisdom with us and your experiences, and thank you for your insights.
Well, thank you. It's great.